We're going to be starting on chapter 7 now. This is going to be the skeleton chapter. Now, bones of the adult skeleton are grouped into two principal divisions. These are going to be the axial skeleton and the appendicular skeleton. So the axial skeleton, this consists of 80 bones, and then the appendicular skeleton is 126 bones. So altogether, the skeleton is made up of 206 bones. Now you can remember the names of the divisions if you think of the axial skeleton as being bones that lie around the longitudinal axis of the human body. So if you draw an imaginary vertical line that runs through the body's center of gravity from the head to the space between the feet, you're going to get all the bones within the axial skeleton. So this is going to be the skull bones, the auditory ossicles, or the ear bones, the hyoid bone, the ribs, the sternum or breastbone, and then all the vertebrae. Bones of the vertebral column. Now the appendicular skeleton, on the other hand, this consists of the bones of the upper and lower limbs, plus the bones that form the girdles that connect the limbs to the axial skeletons. So we're going to get the upper and lower limbs in the appendicular skeleton, and the bones that make the girdles, essentially the parts of the body that attach the upper and lower limbs to the axial skeleton. Almost all bones of the body can be classified into 5 main types based on their shape. So these are long bones, short bones, flat bones, irregular bones, and sesamoid. So like we just learned in our last chapter, long bones are bones that have greater length than width, and they consist of a diaphysis, which is going to be this portion of the bone, and they also have epiphyses, a proximal and a distal epiphyses. Now, long bones are actually going to be slightly curved, and this is for strength, because a curved bone absorbs the stress of the body's weight at several different points so that it can actually be evenly distributed. If the bones were completely straight, the weight of the body would actually be unevenly distributed, and the bones would fracture more easily. Now, long bones mostly have compact bone in the diaphysis, but they have considerably more spongy bone in their epiphyses. Next, we have short bones. These are going to be somewhat cube-shaped. You can see one here. And they're almost equal in length that they are in width. Now they do consist of spongy bone tissue except for around the surface where it is compact bone. Examples of short bones are going to be the carpal bones or the wrist bones, and most tarsal bones, which are the ankle bones. Then we have flat bones. These are generally very thin, and they're composed of 2 nearly parallel plates of compact bone tissue that encloses a rather thin layer of spongy bone tissue. Now, flat bones afford considerable protection and provide extensive areas for muscle attachments. These bones are going to include ones like the cranial bones, which protect the brain, the sternum and the ribs, which protect the thoracic organs in here, and then also the scapulae, the shoulder blades, kind of on the back of the skeleton here. We can kind of see them through the ribs a little bit there. Those are all going to be types of flat bones. Then we have irregular bones. These are bones that have very complex shapes and they can't really be grouped into any other category. These bones are going to vary in the amount of spongy and compact bone that's present. And these bones include the vertebrae, like we can see in this picture here, or the backbones. The hip bones would also be an irregular bone type. And certain cranial bones and also the calcaneus in the foot would all be classified under irregular bones. Then there are the sesamoid bones. Now sesamoid, this term literally means shaped like a sesame seed. And sesamoid bones develop in certain tendons where there is considerable friction. They're also going to develop in tendons where there is a lot of tension and a lot of physical stress, such as the palms of the hand and the soles, or also in the knee. Now these bones kind of vary from person to person, and they're not always completely ossified. So we talked a little bit about the different classifications of bones. Now let's discuss some bone surface markings. Now bone surface markings are created in response to tension on a bone surface from things like tendons pulling on bones, ligaments, even from new bone being deposited, and these all result in raised or roughened areas. Now on the other side, compression of a bone surface results in a depression. Most surface markings are not present at birth and are most prominent in the adult skeleton. Now there are two types of surface markings, depressions and processes. So the first bone surface marking that we're going to talk about is a fissure. Now, fissure is a narrow slit between adjacent parts of the bone, and this is through which blood vessels or nerves pass through. An example of this would be the superior orbital fissure, as we can see here in the skull. A foramen is a larger opening in bone through which blood vessels and nerves travel through as well. The optic foramen or the large foramen magnum are going to be good examples of a foramen. A fossa is just a shallow depression, as we can see here with the mandibular fossa. A sulcus is a furrow along a bone surface that accommodates a blood vessel, nerve, or tendon. And then a meatus is a tube-like opening. Meatus means passageway. So like we see here with the external auditory meatus. Now moving on to processes. Now there are three processes or protuberances that form joints. They are condyles, facets, and heads. So the first one here is a condyle. This is going to be a large round protuberance with a smooth articular surface at the end of the bone. We see this at the lateral end of the femur and also here on the mandible as the condylar process. So here we have the mandible, which is the lower jawbone. Here we have a facet, which is the second process that forms joints. So facet is a smooth, flat, and slightly concave articular surface that you can see very well here within the vertebrae. So here we have the facet of the superior articular process in a typical vertebrae. These are usually going to be articulation points for other bones. And then the head. So a head is usually a rounded articular projection that is supported by a neck. Now a neck is usually a more constricted portion of a bone. So here we have the head supported by the neck on this rib here. So we see heads on a femur, so the head of the femur, and we also see a head on ribs like this one here. So those are going to be the three processes that form joints. Now there are other processes that form attachment points for connective tissue, and there are seven different types. So first here we have a crest. This is going to be a prominent ridge or elongated process. We see this here on the sacrum. This is the medial sacral crest. We also have an epicondyle. So an epicondyle is a typically roughened portion above a condyle. And then a line is a long, narrow ridge or border. It's going to be a little bit less prominent than a crest. So here we have a superior neutral line and an inferior neutral line. A spinous process. This is a very sharp and slender projection. So here we have a spinous process on a vertebrae. Trochanters are very large projections. They're found only on the femur. And a tuber hole. Tuber means knob. This is kind of a variably sized rounded projection. So here on the skull we can see an articular tuber hole. And then lastly is a tuberosity. This is a variably sized projection with a rough and bumpy surface. These are usually going to be articulation points for muscles. So here on the sacrum again, we can see the sacral tuberosity. Here we can see a really nice table with all of those bone surface markings that we just talked about, but just a nice summarizing slide here kind of puts them all in one place, useful for studying. So let's talk about the skull. So the skull contains 22 bones. This doesn't include the bones of the middle ears. And the skull rests on the superior end of the vertebral column. Now, the bones of the skull are grouped into two categories: the cranial bones and the facial bones. Now the cranial bones, these form the cranial cavity, which encloses and protects the brain. Now there are 8 cranial bones. It's going to be the frontal bone, 2 parietal bones, 2 temporal bones, the occipital bone, the sphenoid bone, and the ethmoid bone. So those are going to be our 8 cranial bones. Now, the facial bones, there are 14 of them. We may have to make extra room here, but we have 2 nasal bones. We have 2 maxillae. We have 2 zygomatic bones. We have the mandible. We have 2 lacrimal bones. Here, and I'll erase these so that we can add the rest of the facial bones here as well. Okay, so put the rest of the facial bones here. So 2 lacrimal bones, 2 palatine bones, 2 inferior nasal conchae, and the vomer. So those are going to be our 14 facial bones. So here you can see the skull. We have different colors for all different bones of the skull. So we can see here this large blue frontal bone here. This is going to form the forehead, which is the anterior part of the cranium. The frontal bone also forms the roof of the orbits, places where our eyes are held, the eye sockets. And it also forms most of the anterior part of the cranial floor. We have 2 parietal bones, one on either side, in this pinkish color here. These form the greater portion of the sides and roof of the cranial cavity. And the internal surfaces of the parietal bones contain many protrusions and depressions that accommodate the blood vessels supplying the dura mater around the brain. Now we can't see it from this view, but when we look interior, we can see a lot of these protrusions and depressions on the inside of the skull. So here on this picture, we can see that interior view of the cranium. You can see those processes and depressions on the insides of these bones here. Here we can also see the temporal bone in purple here. These bones form the inferior lateral aspects of the cranium and part of the cranial floor. The temporal squama here is a very thin, flat part of the temporal bone that forms the anterior and superior part of the temple. The temple is going to be that region of the cranium around the ear. Now, if we look to the left here, this picture, which is an external view of the skull, we can see the purple temporal bone here from the outside, and projecting from the inferior portion of the temporal squama here is going to be the zygomatic process. So this process here. This articulates with the temporal process of the zygomatic bone. So the zygomatic bone is actually the cheekbone. And remember, when one bone articulates with another, it forms a joint. The occipital bone forms the posterior part and most of the base of the cranium. We can also see the foramen magnum in this view. This is the inferior part of the bone, and this is where the medulla oblongata, or the inferior part of the brain, connects with the spinal cord. They connect within this foramen. The vertebral and spinal arteries also pass through the foramen magnum along with the accessory nerve of the brain. The occipital condyles here, one on either side here and here, these are going to be oval processes with convex surfaces on either side of the foramen magnum. These articulate with depressions on the first cervical vertebrae, the atlas, and they form the atlanto-occipital joint. So the occipital condyles, these are going to articulate with the atlas, which is the first cervical vertebrae, so C1. And together, these occipital condyles and the atlas, they form the atlanto-occipital joint. Now it gets its name from the atlas. That's where atlanto comes from. That's the atlantis part of the joint. And the occipital part of the joint comes from the occipital condyles, from the occipital bone. This joint allows you to nod your head yes. So nod your head up and down. This joint allows you to nod your head up and down. Then we have the external occipital protuberance here. This is going to be the most predominant midline projection on the posterior surface of the bone, just above the foramen magnum. Now you may be able to feel this structure as a bump on the back of your head, just above your neck. This is going to be the external occipital protuberance. The sphenoid bone, this green bone here, it lies at the middle part of the base of the skull. Now, this bone is called the keystone of the cranial floor. So sphenoid bone is going to be the keystone of the cranial floor, and this is because it articulates with all other cranial bones, holding them all together. You can see here at the front, the sphenoid bone connects or articulates with the ethmoid bone. It also articulates with the frontal bone all along here. The sphenoid bone also articulates with the occipital bone back here. It articulates with the pink parietal bone here and here, and also with the temporal bones all through here and here. So it connects with all of those other bones of the cranium. Now the shape of the sphenoid kind of resembles a butterfly with outstretched wings, with a body that is the hollowed cube-like medial portion kind of here between the ethmoid and occipital bones. There are greater wings, which are the larger upper wings, or kind of, not upper I guess, but lower down in the cranium, but they're kind of here. These are going to be your greater wings here. And then your lesser wings are going to be these wings up here. So kind of looking like a butterfly is what the sphenoid bone looks like. The paired maxillae or singular maxilla, these unite to form the upper jawbone. They articulate with every bone of the face except for the mandible, which is the lower jawbone. The maxillae form floors of the orbits, as you can see here on this picture here. So they form those floors of the orbits there and here. You can see back there as well. And part of the lateral walls and floor of the nasal cavity in here and all around there. And they also form most of the hard palate inside the mouth. The hard palate, this is going to be the bony roof of the mouth. Now it's formed by the palatine processes of the maxillae and the horizontal plates of the palatine bones. The hard palate separates the nasal cavity from the oral cavity. Separates the nasal cavity from the oral cavity. Now here we have the mandible, also known as the lower jawbone. This is the largest and strongest facial bone. It's the only movable skull bone other than the auditory ossicles, the small bones of the ear. So here in our lateral view, we can see that the mandible consists of a curved horizontal portion called the body and two perpendicular portions, the rami, singular ramus. Now the angle of the mandible is the area where each ramus meets the body. Now each ramus has a posterior condylar process. You can see that here, big protuberance there. And this condylar process articulates with the mandibular fossa and the articular tuber hole of the temporal bone to form the temporal mandibular joint. So that's the joint that's going to form here by the articulation of the condylar process with the mandibular fossa. And the articular tuber hole. So this is going to be in the part of the temporal bone. We can also see that here is a more anterior coronoid process here. This little process here. And this is where the temporalis muscle attaches. So right here, that's going to attach the temporalis muscle. Now we will mostly be covering this in the lab portion of this class, but here we have a table showing the principal foramina of the skull. So here we have the foramen here, where they're located, and the structures that pass through them. So really nice, useful table here, showing the foramen magnum, the mandibular foramen, mastoid, a whole list there. Moving on to our next topic, we'll very briefly talk about the paranasal sinuses. So the paranasal sinuses are cavities within the cranial and facial bones near the nasal cavity. These sinuses are most evident in the sagittal section of the skull. The paranasal sinuses are lined with mucous membranes that are continuous with the lining of the nasal cavity. Secretions produced by the mucous membranes of the paranasal sinuses will drain into the lateral wall of the nasal cavity. Paranasal sinuses are very small or even absent at birth, but they increase in size during two periods of facial enlargement. So the first one would be the eruption during the eruption of teeth. And at the onset of puberty. These are going to be the main two periods in our lives where these paranasal sinuses really have a large increase in size. Now the paranasal sinuses, their main role is to allow the skull to increase in size without changing the mass of the bones themselves. Now the skull of a developing embryo consists of cartilage and mesenchyme arranged in thin plates around the developing brain. Gradually, there's going to be ossification occurring, and bone will slowly replace most of the cartilage and mesenchyme. At birth, bone ossification is incomplete, and the mesenchyme-filled spaces become dense connective tissue regions between these incompletely developed cranial bones called fontanelles. So we have this connective tissue between these partially or incompletely developed bones. So we have a parietal bone here, frontal bone, occipital bone here. So these are not completely ossified, but you can see between these bones we have this connective tissue here. Connective tissue here and here. It's going to be the anterior fontanelle, posterior fontanelle. These are going to be connective tissue that connects these partially ossified bones. Now, even though an infant may have many fontanelles at birth, the form and location of 6 fontanelles is fairly consistent between all babies. So here we have those 6 fontanelles. First, we have the anterior fontanelle. This one is roughly diamond-shaped and usually closes about 18 to 24 months after birth. This is when it closes. Kind of connects those bones together. Connects the parietal bone to the frontal bone. So this anterior fontanelle is the largest of all the fontanelles, and it's located in the midline among the 2 parietal bones and the frontal bone. The posterior fontanelle is much smaller than the anterior fontanelle, and generally it closes about 2 months after birth. The anterolateral fontanelles, these are small and quite irregular in shape. They're located among the frontal, parietal, temporal, and sphenoid bones, and normally they close about 3 months after birth. And then we have the posterolateral fontanelles. These again are irregular in shape, and they're located laterally among the parietal, occipital, and temporal bones. They usually begin to close about 1 to 2 months after birth. This is when they begin, but they generally don't completely close until about 12 months. The single hyoid bone is a really unique component of the axial skeleton because it does not articulate with any other bone. Essentially, it's like a floating bone. It's suspended from the styloid processes of the temporal bones by ligaments and muscles. It's located in the anterior neck between the mandible and the larynx. Now, the hyoid bone has a couple of roles. It supports the tongue. It provides attachment sites for some tongue muscles and for some muscles of the neck and pharynx. Sorry, I'll rewrite that one, attachment sites here. So these are going to be muscles of the tongue, neck, and pharynx. And not all the muscles in the tongue, neck, and pharynx, but some of those muscles there provides attachment points. Now moving on to the vertebral column. So the adult vertebral column typically contains 26 vertebrae that are divided into 5 regions. So the spine, another name for the vertebral column, makes up about 2/3 of your total height, and it's composed of a series of bones called vertebrae. The vertebral column to the sternum and the ribs all form the skeleton of the trunk of the body. Now, the total number of vertebrae during early development is 33. So 33 vertebrae in early development. Now, as the child grows, some vertebrae in the sacral and the coccygeal regions, they actually fuse together. So as a result, the adult vertebral column typically contains fewer vertebrae, being 26. So here is the distribution of vertebrae in the vertebral column. There are 7 cervical vertebrae. There are 12 thoracic vertebrae, 5 lumbar vertebrae, 1 sacrum, and 1 coccyx. Now, the vertebrae within the vertebral column are numbered according to where they're found. So the cervical vertebrae are going to be labeled C1, C2, C3, C4, C5, C6, and C7. The one right, or the vertebrae right below C7 is going to be labeled as T1 because it's the first in the thoracic vertebrae. So we're going to label these T1 down to T12, and then starting at L1 in the lumbar vertebrae. Intervertebral discs are found between bodies of adjacent vertebrae from the second cervical vertebrae to the sacrum. And they account for about 25% of the height of the vertebral column. Now, each disc has an outer fibrous ring consisting of fibrocartilage, and it's called the annulus fibrosus. And it also has an inner, soft, pulpy, very highly elastic substance called the nucleus pulposus. These discs form really strong joints, and they permit various movements of the vertebral column, and they also absorb a lot of shock. Under compression, they flatten and broaden. Now, during the course of the day, the discs compress and lose water from the cartilage so that we're actually a little bit shorter at the end of the day than at the beginning of the day. While we're sleeping, there's less compression and our body rehydrates so that we're actually a lot taller when we awaken in the morning. Not a lot taller, but slightly taller. Facets of articular processes attach the vertebrae to one another. So we can see facets here. This is going to be a facet of the superior articular process, and it attaches to the inferior articular process, a facet that is just facing inward, so it's just on the other side of this process here, and they attach together. So you can actually see this articulation here between a superior facing facet and an inferior facing facet. Now there are also facets for the heads of ribs just in the thoracic vertebrae. So we can see these here. So here we have faucets for the heads of ribs. Again, we're only going to see those in the thoracic vertebrae. We're not going to see, or there's not going to be any attachments for ribs in the cervical vertebrae and nor in the lumbar vertebrae. Here we can also see the spinous process, that is the sticky out bit on the dorsal side of the vertebrae. And this is the part that you can feel along your back on the dorsal surface. We can also see the spinal cord in this picture here. The spinal cord and all of its nerve tracts are within the vertebral foramen. So it's going to be this foramen going between all these vertebrae here. Now, vertebrae in different regions of the spinal column actually vary in size, but they are similar enough that we can discuss the structures and functions of a typical vertebrae. They all typically consist of a vertebral body, a vertebral arch, and several processes or several projections that they have. One thing is that the first two cervical vertebrae are going to be quite different from all the other vertebrae in the spinal column. So when we're talking about a typical vertebrae, we're talking about any of the other vertebrae apart from the first two. So here we can see kind of a typical vertebrae on the left here. First we have the vertebral body. This part here, this is going to be a thick disc-shaped anterior portion, and this is going to be the weight-bearing portion of the vertebrae. Its superior and inferior surfaces are roughened for the attachment of the intervertebral discs. So those discs fit between the bodies of adjacent vertebrae. There are two thick processes, the pedicles, which are going to be these little processes here, one here, one here. These project posteriorly from the vertebral body, and then they unite with the flat lamellae. So these flat portions here. And the pedicles and the lamellae together form the vertebral arch. So the vertebral arch extends posteriorly from the body of the vertebrae. So we can see kind of this arch around like this. Together, the vertebral body and the vertebral arch surround the spinal cord here in the center. And they do so by forming the vertebral foramen, this hole in the center of the vertebrae. Now, the vertebral foramen contains the spinal cord. There's also adipose tissue, areolar tissue, connective tissue, even blood vessels are all found within the vertebral foramen. Now, these pedicles, they have superior and inferior indentations, and these are called vertebral notches. So it's kind of, you can't see it very well here, but there's kind of a notch there and a notch here. So these are intervertebral, or sorry, just vertebral notches. And when these vertebral notches are stacked on top of one another, they form an opening between adjacent vertebrae on both sides of the column called the intervertebral foramen. And this intervertebral foramen allows the passage of a single spinal nerve carrying information to and from the spinal cord. So we can't see it terribly well on this picture, but we can tell there's a little hole here where those pedicles are, kind of a hole through the center where the spinal nerve can actually exit there. Now there are 7 processes that arise from the vertebral arch. At the point where the lamina and the pedicle join, a transverse process extends laterally on each side. So we can see these 2 big transverse processes here. There's also a spinous process that projects posteriorly from the junction of the laminae. Sorry, these are laminae. Lamina, I might have said it differently before, but they are laminae. Now these 3 processes, the 2 transverse processes and the spinous process, these serve as points of attachment for muscles. Now the remaining 4 processes form joints with other vertebrae above and below. So there are 2 superior articular faucets. So those are going to be here. There are 2 superior articular processes, and these are going to form joints with the 2 inferior articular processes of the vertebrae immediately above them. So here these superior articular processes are going to connect to the inferior articular processes of the vertebrae right on top of them. And we can see this here as well. We have this superior articular process here, and here we can see an inferior. So they kind of connect like a little puzzle, we can see right there. Now these articulating surfaces of the articulating processes are referred to as faucets, and they are covered with hyaline cartilage. Now let's look at specifically cervical vertebrae first. So the bodies of the cervical vertebrae, remember these are from C1 to C7, these are smaller than all other vertebrae except for those of the coccyx. The cervical vertebrae arches, however, are longer than the others in the vertebral column. So they have, I'll write it down here, smaller bodies, longer vertebral arches. Now all cervical vertebrae have 3 foramina. They have 1 vertebral foramen, and they also have 2 transverse foramen, 1 on either side here. These transverse foramina allow the passage of the vertebral artery and its accompanying vein and fibers. So it allows for the arteries and veins and nerves from the skull to come down, or to go up rather. Now the spinous processes of C2 to C6 are going to be bifid. So bifid, we can actually see it here on this cervical vertebrae. Bifid means that the spinous process branches into 2 small projections at the tips. Now, C1 and C2, the first 2 cervical vertebrae, do differ quite considerably from the other cervical vertebrae. On the left here, we have Atlas, which is C1. This is named after the mythical Atlas who supported the world on his shoulders. This is the first cervical vertebrae that's just inferior to the skull. It has both an anterior and a posterior arch. And as you can see, it lacks a body and a spinous process. There's no body and no spinous process on C1. So we can write this in here. No body, no spinous process. The superior facets of the lateral masses, these are called superior articular facets. So we can see one here and one here. These superior articular facets are concave, and they articulate with the occipital condyles of the occipital bone, and together they form the atlanto-occipital joints. And we did kind of talk about this joint already before. So remember, this atlanto-occipital joint allows you to nod your head yes. Then we have the second cervical vertebrae, C2. This is going to be here, these two pictures on the right. Now this one is called the axis, A-X-I-S. Now it does have a vertebral body, and it also has this peg-like process called the dens. Now this is kind of a tooth-like process that projects superiorly through the anterior portion of the vertebral foramen of the atlas. So essentially the dens is kind of going to sit right here in the atlas. Now the dens makes a pivot on which the atlas and the head can rotate. So this arrangement allows for side-to-side movement of the head, like when you shake your head no. The articulation that forms between the anterior arch of the atlas and the dens of the axis, this is called the atlantoaxial joint. And this is going to be the joint that allows you to shake your head no. Next, we have the thoracic vertebrae. Now, thoracic vertebrae are considerably larger and stronger than the cervical vertebrae. In addition, the spinous processes on T1 to T10 are going to be long and laterally flattened and also directed inferiorly. So you can see kind of this downward pointing movement. So they're quite flat and long. So this one you can see, especially on T1, is going to be very long spinous process. Now, in comparison, the spinous process on T11 and T12 down here are going to be quite a lot shorter and broader and directed more posteriorly. So they're kind of pointing straight out backwards. They're quite square as well. Now, compared to the cervical vertebrae, thoracic vertebrae also have longer and larger transverse processes. Now, these thoracic vertebrae are very easily identified by their costal facets, or the facets which are the articulating points for the ribs. So these are also called costal facets. So costal means rib. So remember that the feature of the thoracic vertebrae that distinguishes them from other vertebrae is that they articulate with the ribs. Except for T11 and T12, the transverse processes of the thoracic vertebrae have costal facets. We can see one here. These are going to be articulation points that articulate with the tuber holes of the ribs. So we can see here. So another name for these are going to be costal faucets. Remember that costal also means rib. Now, additionally, the vertebral bodies of the thoracic vertebrae have articular surfaces that form articulations with the heads of the ribs. Now, the articular surfaces of the vertebral bodies are called faucets and demifaucets. A faucet, this is formed when the head of the rib articulates with the body of one vertebrae. And a demifaucet, this is when the head of the rib articulates with two adjacent vertebral bodies. So the rib articulates with two vertebrae. So we can see here we have an inferior demifaucet and a superior demifaucet. So articulation with one rib is going to articulate with both the superior demifaucet of one vertebrae and the inferior demifaucet of the adjacent vertebrae. Now, movements of the thoracic region are going to be limited by the attachment of the ribs to the sternum. Moving on to the lumbar vertebrae, L1 to L5. These are going to be the largest and also the strongest of the unfused bones in the vertebral column. Now, one important thing is that the amount of body weight supported by the vertebrae increases toward the inferior end of the backbone. So as we go down to the inferior portion of the backbone, the amount of body weight supported is going to greatly increase. Now, the projections of these lumbar vertebrae are going to be very short and thick. The superior articular process here, these ones are going to be directed medially instead of superiorly. And the inferior articular process, where this faucet is attached to here, these are going to be directed laterally instead of inferiorly. So we can also see these a little bit better actually here on this left picture. So we can see these medially directed superior articular processes, because this is on the superior view. And if we were to flip this vertebrae around on the left and look at the inferior view, we would see that this faucet here is going to be directed laterally. Superior articular process is directed this way, and on the opposite side on the bottom, these inferior processes are going to be directed laterally that way so that they can articulate with one another. Here and here. The spinous processes are kind of quadrilateral in shape, so they're going to be very thick and broad, and they project nearly straight posteriorly. And these processes are going to be really, really well adapted for the attachment of really large back muscles. Now here we have a really nice comparison table of the features of the cervical, thoracic, and lumbar vertebrae here, with the cervical on the left, thoracic in the middle, and the lumbar here on the right. So we can see all the differences and similarities between them. Again, we've gone over all of these just prior in this lecture, but here it's all in one place, really good for studying. Next, we have the sacrum. This is a triangular bone formed by the fusion of the 5 sacral vertebrae, S1 to S5, and it's going to be part of the pelvic girdle. Then we have the coccyx, just like the sacrum, is triangular in shape and formed by the fusion of several vertebrae. Usually the coccyx is formed by 4 coccygeal vertebrae, and they do fuse a little bit later than the sacral vertebrae, usually between the ages of 20 and 30 years old. So here we can see the sacrum and the coccyx. We can see right here we have upper sacrum, lower coccyx here. We have this concave anterior side of the sacrum that faces the pelvic cavity. It's going to be really smooth, and it contains 4 of these transverse ridges or transverse lines. So here, 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 and here. And these are going to mark the joining of the sacrovertebral bodies. At the ends of these lines are 4 pairs of anterior sacral foramen. And at the lateral portion of the superior surface of the sacrum, there's going to be a smooth surface called the sacral ala. And this is formed by the fused transverse processes of the first sacral vertebrae. Here on the right, we have the posterior surface of the sacrum. On this one, you can see the median sacral crest here. There's going to be the fused spinous processes of the upper sacral vertebrae. You can also see the lateral sacral crests on either side here, here, and here. These are going to be the fused transverse processes of the sacral vertebrae. And then also 4 pairs of posterior sacral foramina. Now the laminae of the 5th sacral vertebrae, and sometimes the 4th, actually fail to meet. Now this leaves an inferior entrance to the vertebral canal, which is called the sacral hiatus. A couple of other terms here very briefly. The narrow inferior portion of the sacrum is known as the apex, and the broad superior portion of the sacrum is called the base. The sternum is found on the ventral side of the body, and it's made up of segments that are typically fused by the age of 25 years old. And the points of fusion are going to be marked by those transverse ridges, just like we saw in the sternum. Or in the sacrum, sorry. Now the 3 parts of the sternum are going to be the manubrium, the body, and the xiphoid process. Here we can see those 3 parts of the sternum, the manubrium on the upper portion, the body in the middle, and the xiphoid process here down at the bottom. The junction of the manubrium and the body forms the sternal angle. The manubrium has a depression on the superior surface called the suprasternal notch, and then lateral to the suprasternal notch are the clavicular notches, and these notches are going to articulate with the medial ends of the clavicles to form the sternoclavicular joints. So again, these are going to be the joints between the sternum and the clavicle, which, if we look up here on this right picture, is going to be this joint right here and right here. Now in this picture, we can also see that the manubrium articulates with the costal cartilages of the first and second ribs. See them right here and right here. Now, the body of the sternum articulates directly or sometimes indirectly with the costal cartilages of the 2nd through 10th ribs. So down to the 10th rib all the way down here. And that 2nd rib is going to articulate both with the manubrium and the body of the sternum. Now the xiphoid process down here consists of hyaline cartilage during infancy and childhood, and it doesn't completely ossify until about 40 years old. There's not going to be any ribs attached to the xiphoid process, but the xiphoid process does provide attachment points for some abdominal muscles. Some abdominal muscles are going to be attached here. Now there are 12 pairs of ribs. These are labeled 1 to 12 from the superior to inferior, and they increase in rib length up to rib 7, and then from 7 to 12 they decrease in length. Now each rib articulates posteriorly with its corresponding thoracic vertebrae. And ribs 1 through 7, first 7 here, these are going to have a direct anterior attachment to the sternum by a strip of cartilage, hyaline cartilage, that's called costal cartilage. So 1 through 7 are directly attached to the sternum by costal cartilage. Now these costal cartilages really contribute to the elasticity of the thoracic cage, and they prevent various blows to the chest from fracturing the sternum and the ribs. So the ribs that have costal cartilages that attach directly to the sternum are called true ribs. And the articulations between true ribs and the sternum are called sternocostal joints. Now the remaining 5 pairs of ribs are called false ribs. And this is because their costal cartilages either attach directly to, they just attached indirectly to the sternum, or they don't attach to the sternum at all. Now the 11th and 12th pairs of ribs are false ribs that actually have their own specific designated name, that they are actually called floating ribs. So this is the 11th and 12th ribs, because they don't really attach directly or indirectly to the sternum at all. So here we can see a rib here. We can see that the head of the rib is the projection at the posterior end of the rib, and it contains a pair of articular faucets. We have a superior faucet and an inferior faucet. Now the faucet of the head may fit either into a faucet on the body of a single vertebra or into the demi-faucets of 2 adjoining vertebrae, but regardless, it still forms a vertebral costal joint. Now the neck is going to be the constricted portion of a rib that's just lateral to the head, and a knob-like structure on the posterior surface where the neck joins the body of the rib is called a tubercle. Now the posterior portion of the rib connects to a thoracic vertebrae by its head and the articular part of a tubercle. The faucet of the head fits either into a faucet on the body of one vertebrae, which only happens at T1. So faucets where they connect just to one vertebrae is only going to happen at T1. Or we're going to see them connect by demifaucets. And a demifaucet is going to be connecting a rib to two adjoining vertebrae, and this is going to be all other ribs. Now, the articular part of a tubercle, right here, this articular faucet on that tubercle, is going to articulate with the faucet of the transverse process of the vertebrae. So we can see that here, see that transverse process of the vertebrae, and then we kind of look through the vertebrae here to see that faucet for the tubercle of the rib.